cruel budget when you consider the increase in VAT to 15%. But I think the fundamental problem is that with inflation of 268%, and with the acknowledged fact that most government revenues now are actually in US dollars, this budget, for it to be meaningful, ought to have been indexed in US dollars. And in our view, you ought simply to have announced a 4 billion US dollar budget. If you look at the figures, it's a 4.2 trillion Zim dollar budget, which translates to 4 billion, because he has used an exchange rate of 1:1,000. And if he had expressed the budget in US dollars, it would have allowed him to pay civil servants in US dollars. The failure to pay civil servants in US dollars is a complete disaster. He has reduced the rate of MET tax from 4% on US dollars to 2%. What he really needed to do was to actually scrap the intermediated money transfer tax altogether. But as you can see, it's an anti-people budget. He has increased the VAT to 15%. But more importantly, it's an election budget. It's a power retention budget. Look at the huge amount of resources that he has given to Mvudza, $367 billion, compared to amounts he's given to health, which are less than 15% of the Abuja declaration. So we find it a very anti-people budget, premised on very faulty assumptions. His assumptions are that we will have a good rainfall season. His assumptions are that we will have solid international commodity prices. His assumptions is that we will have more power next year. All those assumptions are wrong and faulty. We already know the challenges of power. We already know the challenge that globally the international the economy is in shrinkage. So it's a pipe dream. It's a pipe dream. But in simple terms, this should have been a budget in US dollars. He should have dollarized. He should have floated the Zimbabwean dollar. He should have reduced the rate of interest from 200% to less than 20%. He should have scrapped export surrender requirements. He should have scrapped the auction system.
Are we going to base for more prices since he refused to renew the import tax?
I think what is going to cause prices to spike is VAT. VAT is an unprogressive tax which affects equally the rich and the poor. So to raise the rate of VAT, an unprogressive tax, to 15% will push the prices of goods. Also, his refusal to reduce the rate of IMMT tax will also push the price of goods. But more importantly, his stability agenda is a mirage. He has tried to control inflation by not paying contractors. But you don't deal with the diarrhea by stitching your backside. The minute he starts paying, people are going to spend and broad money supply will implode. So this is temporal, short-term stability. It is going to implode, it is going to explode. What he needed to do long-term was to simply dollarize, to float the exchange rate, to scrap the auction, to scrap export surrender requirements, and to scrap the gold coin.
Maria tapuwa hii tichazama kuti tishandise nenzira yakanaka yekuti mumwe nemumwe muZimbabwe akwanise kunge achirapwa, nekuti kana achida kusimudza nyika tinongoisimudza chete kune nevanhu vakasimba, tinoisimudza chete nevanhu vanenge vakagwinya. Haugone kuvaka nyika wakarara kumba kana muchipatara. Ndosaka tiri kuti Zimbabwe kutaura kwatenda nguva dzose kuti Zimbabwe inovakwa nevene vayo. Kana chiti inovakwa nevene vayo, chiti iwe neni tine basa, zvinotongobuda chete kana vanhu vakasimba. Saka mari yatapuwa iyi hongu munhu wega wega anenge aida kuti dai anga yaenda pamusoro, asi tinoziva kuti tichiri kusimudza upfumi hwedu, tiri kuenda tichita pashoma nepashoma. kuvaka nekukwidzira kwatenda upfumi ndokusumukawo kunoitawo mari yatoda kutise kuzvipatara. Hatisi kungoita kungorapa chete, asi toda kuti tikwanise kuwana mari yekubatsira avo vana mukoti nana chiremba vedu vanoshanda muzvipatara, kuona kuti zvavanoshandisa zviripo here, ivo pabasa ravo vari kufara here nezvatenge tichivaitira kuenda kwavo kumabasa. Naotherwise tiri kutaura nenyaya dzetransport yavo, tiri kutaura nenyaya dzimba dzavo, tiri kutaura nenyaya yekuti pavanenge vari kusenza vanenge vakamira vakaita sei.
So there were social nets that were put by the minister that I think will improve people's welfare as we move towards economic development.
Of course, we like to mobilize more resources. We run basically a quasi-cash budget system, which is where we use what we've collected for various projects and programs, and with a little bit of borrowing. So really, we are driven by our capacity to raise cash, and so far so good. We have been, financing all government programs that are priority, and I think that we've done very well at that. Of course, ministries get impassioned and so forth. It happens, and they should push, and why not? I would do the same. But we've done our best to make sure that the cash resources that they desire and so wish are given out on time.
Honorable, since the budget was done in local currency, what is being hit by inflation?
Inflation is part of the fabric of what we do. If you're in the economic sphere, there will be inflation to deal with, there will be this and that to deal with. Remember, our domestic currency is the Zimbabwe dollar. So we're budgeting in Zimbabwe dollars. We allow transactions to take place also in US dollars. We've been doing that. So there is no issue about budgeting in Zimbabwe dollars with the impact of inflation on that. And our job is to deal with that inflation, and we're dealing with it.
Okay, then probably on the VAT, there could be an outcry that prices are going to go up.
Look, this is 0.5% change. For a start, the average VAT rate in SADC region is 16%. So even where we were in 2019 at 15%, we were 1% below the average for the region. And we took it down to 14.5% from 15% to support the citizens and the economy due to COVID. Now we've opened up the economy. I think we've tried hard to deal with COVID, and in fact successfully, in fact. And we feel now it is time to take it back where it was at 15%. And this is only a 0.5% increase. It will go a long way in raising adequate resources for government to finance vital programs to support our citizens. So really, we're taking from citizens to give back to citizens.
And lastly, just on COVID, the budget declaration last year, the allocation was around 20%. Now we're looking at 10%.
In terms of the above the line budget, which excludes things like interest payments and so forth, actually our health sector allocation is 13%. So it's the same as last year. The figure of 11% that I mentioned has to do with the overall budget of 4.2 trillion, where we include below the line items. But look, we've worked very hard, we've tried very hard to meet the target, and we'll continue to do so. We're doing a lot in the health sector. Building infrastructure, even remuneration for nurses. We're still losing nurses, that's very sad. But we'll try our best to find a way to retain them. We procure drugs, we're recapacitating our hospitals, upgrading our hospitals. So really we're doing a lot in the health sector. But we also need to find a way to work with the private sector. Have you counted the number of new private hospitals in Harare over the last 2 years? Who has been counting? There are so many, they're mushrooming everywhere. So really it's clear that there is a growth in the health sector, in the private sector. So there's a need to come up with some synergies, maybe a public-private partnership way to work with the private sector so that if there is no equipment at the public hospital, someone is able to access that service from a private hospital at an affordable cost. So the issue really is about access. It's about access, not so much the availability of the service. Service is available, but at high cost to a citizen. But we need to improve that access, and we as a government are determined to work in that.